Welcome to today's lesson. I'm going to share my screen now with you. So today we will be looking at an overview of Unit 1. So the objectives for today's lesson are as follows. So upon completion of this unit, students will be able to establish the present state of the world's environment. So that is, we need to be able to scientifically collect information, interpret that information, and be able to report what is happening in the environment. Um, at the end of the unit, you should also be able to identify clearly what the environmental threats to human health may look like. You should be able to identify the needs, not identify the needs, sorry, but understand the need to find solutions to environmental health problems. And finally, you should be able to discuss the choices that have to be made to achieve the WHO goal of health for all. So you would be introduced to some of these concepts, additionally, many of which should also not be new to you, but we're just pulling a lot of your prior information and knowledge and understanding, pulling it together in the context of human health and the environment. So over the next couple of weeks, the activities that would be administered for this unit. So for this week, you would have a reflective journal. So students would be required to complete a journal activity based on the content provided. This journal activity will contribute to the 10% weighting for your final grade. So if you recall from your summary of assessments for the course, the aggregation of all your online activities will contribute to the 10%. So this journal will also contribute. You can refer to eClassroom for details and instructions. And the following week, we're looking at having a review quiz that would review the content that you have been introduced to over the weeks of the unit. And as well, the marks that you get for this quiz will also contribute to your 10% towards your final grade. You may also be required to do another unmarked activity in that week as well. So again, all details will be provided on eClassroom. So what I would like to do now is just have a brief overview of the content of the unit. Material will be provided for you on eClassroom for you to review details on the issues highlighted here in this lecture. So maintaining a healthy environment is central to increasing the quality of life and the years of a healthy life. More and more scientists are beginning to see and understand that interconnectedness between the health of the natural environment and the health of the human being. Not only in terms, not, not only in terms of the length of life, so that's human lifespan, but also what quality of life. Because many of us, I think by now, are old enough and mature enough to recognize that even in many countries where you may have an aging population, you have an aging population where the quality of life is not necessarily a good one. You have a lot of very sick people, and quite often you would find that it's medication and medical sciences that are keeping them alive. So these are some of the things that we want to look at. Is the environment and the health of the environment contributing to some of these things? We would be looking at that over the course of this semester. Now, globally, 23% of all deaths and 26% of deaths among children under the age of 5 are due to preventable environmental factors. So when we talk about these deaths, bear in mind these deaths may not only be as a result of, let's say, silent environmental killers such as pollution, etc., but then also consider the impact on health and well-being of some of the phenomena that come out of climate change, such as increased numbers and severity of natural disasters. So you also have the environment impacting on health and well-being and even life in that sense. So the poor environmental quality has its greatest impacts on people whose health status is already at risk. So let's consider, for example, a lot of respiratory illnesses, persons who have pre-existing respiratory illnesses. If when you have bad air quality, indoor air quality or outdoor air quality, these are the people who would be at greatest risk of probably having, um, let's say, sinus allergies or asthmatic attacks, etc. So if you have a pre-existing health concern, the poor environmental quality can exacerbate that. Additionally, when we look at the impact of the environmental risks, we need to understand that even understanding that is a very complex thing. Um, that risk needs to be determined, and it can be very complex in actually making those determinations. You want to look at the severity of that impact. And when it comes to human health, that impact on human health, even that as well is a big challenge, because now you need clinical evidence, scientific and medical evidence to determine that, first of all, there is an impact, and also to establish that that health impact is actually directly connected to your environmental health quality. So there you would have some challenges in establishing that link. Human health impact. The human health impact of environmental factors can also vary from one population to the next. Some of the influencing factors could be geography, in terms of location, um, let's say climatic regions, different climatic regions of the world. You find, for example, in this particular time where we are dealing with coronavirus, one of the things that you're hearing a lot about is the, let's say, the importance of vitamin D and sunlight on um, person's ability to resist some of these diseases. And then when you consider the difference between one climatic zone and the next, where the sunlight may not be as abundant, geography can play a role there. Then there is differences in ethnicity from one region to the next. And we find that science has also shown us that different ethnic groups tend to have different health risks. So if you have different health risks, and then you have to face um, poor environmental quality, those pre-existing conditions can be exacerbated by the environment. Then there is economy. We often find an economy would also influence things like diet, sanitation, even lifestyle. Um, Culture will also influence these things, and again, there can also be a connection there in terms of how environmental quality can affect people groups influenced by these different socio-economic conditions. And again, over the course of the semester, we get more into this. So one method of establishing that link between environmental and human health impact is environmental monitoring and reporting. So the significance of environmental monitoring and reporting, you all should already understand at this point. So that is essential. The investigation and collection of our scientific data and the reporting of that data is very important in terms of us being able to establish that link. Um, Now, what is the significance of the Earth Summit that was held in Rio de Janeiro in 1992? This actually provided the opportunity to shift our focus on the integral connection between the environment and sustainable development. So, if we are talking about sustainable development, human health must come into that, because you cannot have sustainable development and ignore the issue of human health. All right. So, especially where the quality of our environment is concerned and the impact on our human health, pollution has a very big focus there. What are some of the things that can affect our human health? Things like exposure to chemicals, heavy metals, persistent organic pollutants or POPs, um, even ozone depletion, noise pollution, all of these things can affect our human health. All right. So, sustainable development really cannot be achieved if we ignore that issue of human health. Now, getting back to the issue of reporting, the global environmental outlook, the GEO report. This provides critical environmental and socio-economic information that is required to make that link. We know that the decision makers at the legislative and political level, they need that information. Many of them, they don't even understand the nature of the environmental problems. But if scientific um, data and information is provided to them, um, it is an opportunity for them to be educated and for the issue to be brought up on their agenda, on the national agenda, right? So understanding what environmental factors affect human health is difficult, and very often the more we know is the more we realize that we don't know. That is the reality of it. Um, there's a lot of information and understanding about the environment and even human health, but at the same time there's just the whole science is just so complex, and there's just so much to understand and so much we do not yet understand that obviously we can't give up. The human nature is such that we have to pursue knowledge and understanding. And if we don't pursue that, how do we understand what we should be doing and how we should behave, in order that we have that final feedback um, coming back to us where our human health and well-being is improved? Because at the end of the day, much of what we are dealing with now in terms of human health is from generation to generation. There was much that we never understood, and now we are reaping the fruit of what we have sown. So, along with the human toll of disease, the burden on our health sectors, with increasing morbidities and illnesses, that there's that burden on our health sectors, not only in terms of resources, finances in the current global economy. All of these things are really taking a toll on health systems around the world right now. Um, we also have degraded resources and long-term social consequences as well. You have increasing mental illness, depression, and all kinds of other perspectives on social consequences that come out of that. We also have developing countries who generally bear the economic cost of lost productivity, um, with all these illnesses and sicknesses and shortened lifespans, etc. Now, environmental policies, they are difficult to make and to evaluate. Um, Environmental health information is critical for environmental health decision making. Often our national agendas are often driven by economic and social priorities. So, we want to make sure that our economy is up and prosperous so that we can meet all the social needs that are out there. um, but at the same time, we've often been neglecting that environmental focus, which can have that feedback impact on our human health. And therefore, credibility of claims of human health impacts must be established by robust science. Um, that science, as I mentioned in a previous slide, is what is going to inform policy making. But even with, if you throw back to our ENVS 460, you'll recall that even with environmental policies, our environmental policies must be reviewed from time to time, because you need to know if your policies are having the kind of impact that you need them to have. So environmental health impacts can be established as far back as the early years of the Industrial Revolution. That's around the 16th, 17th centuries in Europe and North America. So for those of you who recall from your, I think maybe secondary school history, you will recall that some of the conditions characterized by the Industrial Revolution is poor working conditions and living conditions in crowded urban areas, where you found that there was a lot of rural to urban migration toward the areas of industry, um, looking for work, and really with the intent to try to improve standard of living. All right, but because of that overcrowding, you found that there was really poor living conditions. um, in addition to which, at that time, you found an increasing natural resource consumption, and this is when we actually started seeing evidence of increasing environmental pollution. And we have been grappling with, the world has been grappling with that problem ever since. um, Therefore, there has also been significant improvement in many of these areas, largely due to what? Um, the developments of legislation outlawing child labor. So in those days, there was a lot of child labor, reduction of long working hours. All of these things would have been associated with the rise of labor unions, that would have been pushing for and demanding improvements in working conditions. And also at the same time, uh, coming out of that, you found improvements in standards of living. So a lot of those early conditions in those urban areas, which were associated with poor working and living conditions, which would have impacted on human health, um, you had a shift taking place at that time. Additionally, resulting from the growing awareness of the human health impact of environmental risk factors, World Health Organization in 1998, which again would have been coming out of that Earth Summit in 1992, adopted a new global health for all policy. What is this health policy? Some of the areas of focus would look at health equity. So you're looking at uh, what the various countries' health system model would look like, equality of access to health care, affordability, things of that nature. It would also look at the eradication of some diseases, improvements in access to water and safe water supplies, improved sanitation, food and shelter, development and implementation of health for all policies at the local levels. To promote environmental health for all, supportive environments must be provided. So these supportive environments, you would have to look at it in various areas, from the social perspective, political, economic, and also gender equality dimensions. Um, what would those supportive environments look like? So for details, you can refer to the lesson notes provided on eClassroom. All right, so those supportive environments um, should create the opportunity for equal and fair access to health services, and also towards positively impacting our environment. So at this point, I would like to say thank you for joining me for today's lesson, and I would like to direct you to eClassroom for the additional reading material and associated activities and details.